Hi, my name is JC.
My name is Juan. Welcome to The Couch, a podcast where real therapists talk about real things.
Just as a reminder, while we are therapists, we are not your therapists, and this podcast is intended for educational purposes only.
So this is a exciting episode, and impromptu, and a common one. Do you work with a lot of people that share wanting support with overthinking?
I do. I really do. I find that it's really common for people to sort of cycle through their thoughts and maybe give them a little bit too much power.
Yeah.
Which is an experience in and of itself. What about you? What do you usually see when your clients are bringing up overthinking?
I see overthinking. I see there's like the indecisiveness. There's the worst case scenario that goes with overthinking. There's trying to get everything exactly right and perfect. So then that drives that overthinking. I noticed that sometimes the overthinking can develop in different areas of a person's life. And maybe they came from a household, parents had really strong, high expectations. So this person, they're trying to get everything right. So they're really just replaying situations. It could be a simple text message, and they're looking at it over and over and over to just make sure that what they're going to respond back is exactly right, so that they can feel okay about it.
Absolutely. I think it stems from a bit of a control issue as well. Life is pretty unpredictable. And so I think a lot of folk that are overthinkers tend to be so because they really want to hone in on the perfect way to do something.
With overthinking, let's start from like a very basic definition. And let's brainstorm through it. And I know for me, if I have overthinking on the top of the paper, basic definition, I'm thinking that this person is consistently ruminating on thoughts.
I'm thinking they're cycling a lot. So maybe the same situations, scenarios, or people come up in their thoughts over and over again.
Yeah. And they're as they're cycling on this thought and they're overthinking, I see that person also going into a category of being unproductive.
Absolutely, because there's a sort of paralyzing effect that overthinking has. If I can't do it right, I'm not going to do it at all.
Correct. And then that, right, exactly what you mentioned, I think that begins to disrupt their life. And it could disruption could be very quiet. It could be very loud, quiet to the point that many people around them don't know it's happening, but in their mind, that person is fixated in that topic. Or loud, where they're skipping out on maybe going out or starting a new relationship because they're overthinking of, is it the right time to start this relationship?
Oh, absolutely. That is a very, very common one.
What are the signs of overthinking?
Some other signs that I usually see of folk that are overthinking is what I describe as like a snowball effect. You start to ruminate on one thing and it bleeds into another thing, then it bleeds into another thing. And all of a sudden you have way too much of a backlog to deal with anything. And you kind of just stick yourself in this place where you can't move. You're immobilized by all the thinking. I also find that people who are overthinkers usually get pretty poor sleep because they lay down and the minute their body is no longer moving, their brain takes over. So they lay in bed for hours thinking about everything that's going on.
Yeah. And what I'll hear is somebody will sit across from me and they'll tell me, I'm mentally exhausted. I feel like my mind is just repeating certain situations, or I just continue to second guess over and over and over. And if there's overthinking with like anxiety, then I'm thinking about this really bad thing happening or the worst thing happening. And if the anxiety is high, or even with the depression, then it could be a fixation. So like consistently thinking about something outside of their control going really, really bad. And then that's causing them at that internal level, as you mentioned, snowball effect. They're wound up, overwhelmed, lying in bed. The body is very still from the outside, but inside everything is just like turbulent water.
Mm-hmm. That's definitely one of the larger ones. I find that overthinking in children shows up as low self-esteem sometimes, where they'll really overthink the way that they talk to their peers, the way they talk to teachers, and it sort of just creates a space where they feel paralyzed, so they don't feel comfortable talking to folk. They don't feel comfortable making their own decisions because they're afraid they won't make the right one.
Yeah. And with kids too, very similar to adults, there's the issues with sleep, and I think with the example you gave, that can lead to withdrawing, right? So now the child, a young kid, adolescent, teenager, they're withdrawing from hanging out with friends, withdrawing from typical social situations. Sometimes I'll see, and I'll have to be careful with this when I'm working with kids, is I'm thinking ADHD because the child is fidgety or restless. But then as I get to know them a little bit longer, then we're learning that, well, hold on, this restlessness is because inside you're having these anxious thoughts, right? So you're so wound up inside that it's just spilling out, and somatic, right? The body is showing fidgety, restless behavior.
Yeah, or that incredible tension that adults experience. So tight shoulders, tight jaws, tight chest.
Yeah.
Which some of these things that we're describing are common with anxiety specifically. So maybe you're an anxious person, but you don't think you're an overthinker. And that those things are not typically separated.
Correct, yeah. There was this episode I remember of, you ever watch Modern Family?
I have, yes.
Okay, so the daughter that got into one of those really big math and science schools, I forget her name, Phil's youngest daughter. Yeah, so she has this situation where she ends up seeing a counselor, and there's like moments in the show where she's studying and walking with a book like a zombie. Everyone's like, "Hey, what are you doing?" She's just, "I'm studying." She gets to this point of having this high expectation on herself. She has to be successful. So there's like this discussion within the weeds of perfectionism in there. But I also see an aspect in there of overthinking. And then that, I think, in that character leads to maybe second guessing certain things, or the issues with sleep, withdrawing from certain social activities. It's not as loud, but that's just one that came to mind.
Yes, definitely so. So what we're basically trying to tell you guys is that overthinking can look a lot of different ways, but if you find yourself with this poor sleep, this tension, you're fidgety, you're replaying conversations in your head over and over again and second guessing the decisions that you made throughout the day, you may be experiencing an episode of overthinking.
Yeah. And as you were pointing out earlier, this has a little more to do with like diagnosis, which doesn't have to be a huge conversation. I just want to plug it in for a small amount here. Overthinking can have an association with anxiety disorders, such as generalized anxiety disorder or panic disorder, social anxiety disorder. That's probably a big one there, PTSD. And then I've worked with individuals where it's been in depressive disorders. And then I think I'm missing OCD, obsessive compulsive disorder. So if you're listening in and you're noticing, oh, I think I've worked with a counselor or some sort of mental health professional on anxiety, and then I struggle with overthinking. I'm bringing this more up as that association. There's that relevance there, and knowing that can be empowering because then you're able to see how some of the symptoms spill out into the anxiety, we'll say, category.
Yeah, absolutely. So the real question is, right? Yeah, that's the real question. How do I stop overthinking?
You don't. There's no way. No, I'm just kidding. That'd be
I was going to
terrible.
say, wow, that's crazy. Just take the
Yeah.
people's hope, I guess.
No. We're here to give hope, JC.
Listen, you who told there wasn't anything they could do about it,
No, I
but it's
heard I
okay.
heard that I heard that voice. That must have been like a third person that popped on here.
It must have been. It had to have been. But there are plenty of ways to negate overthinking, and they are things that take practice. So, as you're listening to these, maybe you guys can jot down some of these that sound like they would be helpful for you. And one of the first things that we can do is settle for good enough over perfect. So, we talked a little bit about that perfectionism, right? I want to say it just right. I want to craft this text message and do this thing exactly as I'm supposed to. Sometimes that's not possible, and that's okay.
Yep.
It is a-okay. You can do this by giving yourself some time to breathe through a decision. If you find yourself getting heightened and tense, taking a big deep breath in through your nose and out through your mouth a couple of times to help regulate before you make the decision, and understand that it's okay if you make a decision that's not ideal. Or you can give yourself even a time limit to think for how long you're going to research what the decision is you're going to make, or how long you're going to sort of like fixate on this thing.
I like that one. So that one, am I correct? That goes a lot into like giving yourself a break, stepping back, distraction. Yeah. I think that's a powerful one. And often, not often, sometimes I'll have individuals that will share with me, it doesn't solve it, which I think there's an accuracy to it. So if we dig a little bit further, right, you're overthinking, which on a basic level means there's something in your mind that you're thinking a lot about. And you're thinking a lot about it because you're trying to solve it. So if we look at it in that just very simple black and white way, what we're saying here is if you take a step away from it, it's still going to be there, right? It's still going to be there in color red, and you're just putting that on the wall. It's a sticker on the wall called overthinking. So then we're saying take a step away from it, shift your attention to the other wall. Maybe the other wall is a green sticker to go for a walk or watch something funny. And then go do that different thing for a good while. Your brain now is going to get to rest. And then while the brain gets to rest, it has enough time to have new ideas, new thoughts, new ways to look at that red sticker that's on the other wall. And then later you'll come back to that red sticker with new tools, new strength, new empowerment, and it may lead to a better outcome. I like here, which goes more into like the foundational skills. So developing emotional intelligence, looking at self-awareness, looking at mindfulness, maybe digging into interpersonal skills, building self-confidence, self-control, developing practice in the area of boundaries. Those are all big topics. Working with like a counselor, getting a good self-help book. I strongly believe that if we work on those areas, we have a stronger fighting chance when it comes to this thought that we're just consistently thinking about. Now we have the right tools to, box with it a little bit better.
I talk about the toolbox all the time with my clients. Like, okay, how are we going to build up your toolbox? Because we can't always avoid the distress that overthinking might bring to us, but we can figure out how to deal with it the best way we can. And like you said, Juan, we kind of give ourselves a fighting chance.
Yeah. With overthinking, do you find that, and this goes into like how do we address it? Do you find that with individuals there is I overthink and then I treat myself in a negative way?
Oh yes, absolutely.
Yeah.
I ruminate, I overthink. Oh, how could I have said this? How could I have done this? I should have done X, Y, and Z. I could have done X, Y, and Z, which that negative self-talk isn't going to change the decision that you made.
Yeah.
So we have to do
Go ahead. No, you're good.
We just got to do a little bit more work on really trusting ourselves.
You took the words right out, trusting ourselves. Yeah, perfect. That's exactly it. This was, I think, a client that I worked with years ago. and we were talking about overthinking, and this just came to my mind. But we did like a really slow mindfulness process of it, and then they were like, you know what? When I overthink, I treat myself like shit, and I was like, okay, that's strong. Tell me more. And they just laid it out. They were like, when I do this, I'm overthinking, and then I'm so hard on myself, and I'm just taking a step back and just really, listening in here and being with them in this moment. And then at that point, I said, well, once you do treat yourself like shit, let's look at this as like a superhero. Are you weaker now? Like, do you have less strength? Was that kryptonite that just got on you if you're Superman? And they're like, yes. Right now, I'm not as strong. And for me, that really stuck out. And I think it stuck out for them as far as, okay, now if I've got this kryptonite, bringing me down, what fighting chance do I have on going back and trying to address this issue that I was engaging in overthinking? And it's a low chance.
Absolutely.
So the research here, like on self-compassion, there's plenty of it for us listening on the podcast. And a simple way to look at that is self-compassion. That's going to help to reduce the way that you treat yourself. Right now, JC, I just had a brain fart. Like, I'm like, I know what the research says, but my brain was like,
I got you.
I'm not sure if you do.
It's totally fine. We all have our hard resets. Tag me and coach. I got you.
Go in.
Cool. So when it comes to self-compassion, we're treating ourselves with kindness. We're treating ourselves with understanding. We are accepting ourselves for exactly who we are. When you are prone to overthinking, you have a perception that what you do isn't good enough, or that what you do isn't ideal, or that what you do is in some way, shape, or form harmful. And in some cases, that might be the case, especially if you're, participating in risky behaviors that could potentially negatively impact you. But when we treat ourselves with self-compassion and we allow ourselves to make mistakes and we become more okay with making those mistakes, it makes it easier to not get so fixated on the small ones. It allows us to better reflect. It gives us more space for insight, helpful insight. Not, oh, I'm such a bad person. I should have done this. That was so stupid, blah, blah, blah. That's unhelpful now because the decision is already made. So how then do we move forward with a compassionate hand over our heart to say, yeah, I made a mistake. It's cool. Let's persevere. Let's keep going.
Perfect. Thank you. That was well said, well put, well laid out. What is someone listening out there and they're thinking, okay, I'm doing that. I got a lot of overthinking or some overthinking happening. What's a tool you could give them to use?
I'm a really big fan of assigning worrying time with my clients.
Powerful,
so quite literally, I would have people make an alarm on their phone. Like it's 3:45. It's time to worry. I'm going to give myself 20 minutes to sort of worry about what's going on today and maybe like think over some stuff and chew on some stuff. And then once that 20 minutes is over, that's it. That's what we've done for the day. And you'd be surprised at how effective it is to schedule in that sort of overthinking time. And honestly, what will happen is, my clients might use it for a little bit and then they'll say, yeah, I've turned off the alarm every time it's gone on because I haven't really needed the 20 minutes in a while.
I like that one. It's purposeful and then it's going to happen, the overthinking. So you're organizing it into your life.
Absolutely. And sometimes that alarm is so inconvenient. Like I have other stuff that I need to do. I can't spend time worrying about this. And then you get into the habit of saying, oh, like I'm living my life right now. I don't need to be worried about these things.
I like that one. I'll make mine hopefully parallel to that. That was a pretty powerful exercise. So I'll take you to the direction of awareness of when you are overthinking. And here, really what I want you to look at is when you are overthinking, use green, red, yellow. Green is you're treating yourself very well. Yellow in the middle. Red, not so hot. And then just try to note that down. And then when you note it down, see what comes back. Is it yellow? Is it a lot of green, a lot of red? And then use that as a moment of awareness. So that could be really helpful. And if you see a lot of red, the nudge will be, okay, I need to dive into further work. And maybe that's a self-help book or reaching out to somebody. If you see a lot of yellow and green, it looks like you're utilizing effective tools. So that's probably going to push you to look at, well, what are you doing? And then you may use them a little bit more. This was a fun episode. I enjoyed this one, Overthinking.
Yeah, this was really nice. Like, overthinking is so common, and I really hope that somebody listened to this and we help them normalize their experience and also get a little bit more insight so that they can maybe stop their overthinking as much.
Yes. Well, nice. I'm excited for people to listen to this one, and we will catch you in the next episode.
See you guys later.